What's up guys, Dr. Beau here, and today I'm answering all of your questions about hamstring strains, pulls, and ruptures.
How can I help you today?
All right, can you guys see this or not? Check this out. If you guys have never done a Spartan race before, I highly encourage you to give it a try. Matter of fact, in one of my previous videos, you can actually follow along with me and my wife and a group of friends of mine that did a Spartan race. I literally wore my GoPro on the top of my head and I showed you guys all 10 miles, all the obstacles, everything. And to give you guys a little bit of inside knowledge, it totally kicked my butt. But it was awesome. And I actually signed up for another one here coming up on March 15th in San Luis Obispo, California. So if you guys are headed out there, please let me know. Please let me know if you guys done a Spartan. And if you have, you know that you get one of these really cool Spartan medallions, and it even has this like third piece here because they want you to do 3 races for what they call a trifecta. But with that being aside, I want to talk to you guys today all about hamstring strains, hamstring pulls. Matter of fact, when I was at the race, I had somebody stop me and said, "Hey, Dr. Beau, I think I pulled my hamstring." And I was like, "Oh, that's no good. Well, you better wrap it up and ice it and then give me a call and let me know." So today's episode is all about hamstring strains and what you need to know about, how to rehab it, and what's going on so you can get back to doing your running, back to your sport, even doing a Spartan race if that's up to you. All right, so let's dive in a little bit to what a hamstring strain is. I got a few different props and things over here for me, so I want to kind of first talk that down a little bit. All right, so I'm going to pull out my handy dandy iPad here and I'm going to try to bring this up so you guys can see it. So this is the back side. I'm going to try to show you guys in this app right here. This is called 3D4 Medical. It's an app that I use all the time with my patients. Sorry, I know the ring light's there. But basically there are 3 different muscles here of the hamstring. So this muscle right here is called your semitendinosus. There's one on the inside called semimembranosus. And then you have this other one right here called your long head of your bicep femoris. If you guys can see that, yeah. Now, what you need to know is this, is that your hamstrings are actually 3 different separate muscles that all work together as one. So when somebody says, "Hey, I think I strained my hamstring," they're actually talking about a group of muscles, not just one in particular muscle. However, as a doctor on my side, when I start to evaluate a patient, I'm literally trying to dissect it down and say, okay, which one of these 3 muscles did the athlete injure? Now, first things first, I will tell you this, most, and I would say most being a high percentage of hamstring strains or pulls are located up at the top portion of the hamstring, right underneath your butt cheek, so to speak, almost where you sit on that bone, that ilium bone, that ischial tuberosity. That's where people typically feel a quote-unquote pulled hamstring. So if you're working out and you feel like kind of like that sharp tenderness underneath your glute, that's what it is, guys, and that's where most quote-unquote pulled hamstrings occur. Now, a fully torn hamstring or a higher level grade of hamstring, we'll get into that in a second, that is usually felt more in the muscle belly. So instead of it being really up high near that origin, it actually happens down lower in the muscle belly. And that's really important, especially if you're going to talk about rehab or you're sitting down with your doctor and you're trying to describe what happened. Now, I will go far and say this, most hamstring strains or most hamstring pulls occur in the motion of deceleration. Now, this is a huge common myth because most people think, "Beau, I took off running and I was running and that's when a hamstring strain occurred." And really, guys, that's not the case. Usually a hamstring strain occurs as we're slowing down. And the reason is because if you're running really fast, as your body's getting ready to slow down, you put your heels up to hit the ground to slow yourself down. And what that does, if you think about that picture we just saw, that's going to lengthen out the actual hamstring. And as it's lengthening and bringing more tension on it, that's when we tend to pull the hamstring. So the most common way to do it is actually in the motion of deceleration. Matter of fact, if you watch like the Olympic runners or the sprinters, typically when they pull their hamstring, it's after the finish line, and that's when they tend to notice it. Or if they're doing a sport where they're doing a lot of extension with their heel hitting the ground first. Now, when you talk about a hamstring strain or hamstring pull, there are 3 different what we call grades of hamstring strain. Now, your grade 1 is typically where you say, hey, it just feels weird, it feels off, it feels tight. It feels like, you know, I just need to quote unquote stretch it a little bit more to help loosen it up. That's a grade 1 strain. A grade 2 strain is where you can actually feel and pinpoint and say, hey, Dr. Beau, hey, doctor, here's where I feel like it's at. I run my hand down the back of my leg, and I can feel a deviation. If you think about it, like if you put your hand on top of the muscle and you're rolling it down, does the muscle go and deviate down, like almost like a little dip sensation and then come up? Because if it is, that's typically where the tear or the pull has occurred. And then the third hamstring strain or pull or tear is a complete tear. So literally you can run your hand and there's like nothing, and then you can go and it shows up again. And when you have a grade 3 tear, that is a much bigger injury than a grade 1 or a grade 2. Now, I will say that 85 to 90% of the time when an athlete comes into my office, they are a grade 1, maybe a grade 2. A grade 3 is super, super rare, and when it happens, there's no doubt in your mind that you absolutely just tore your hamstring. And the reason I say that is because typically you can't move, you can't bend the knee at all with a grade 3. There's an extreme amount of pain. You're literally tearing a muscle, so you get a lot of bruising, you get a lot of swelling. It's a really, really bad situation. Now, how do I care for it? That's the question I know all of you guys are here wanting to know. So here's the deal about how to care for a hamstring strain. The first thing is this, is we need to classify grade 1, grade 2, grade 3. If it's grade 3, guys, you gotta go see your doctor, probably an orthopedist, you know, your medical doctor. You gotta obviously apply lots of ice, and you wanna wrap the hamstring. Matter of fact, for all 3 of them, I encourage using like an ACE bandage to wrap, but especially for a grade 3. Now, let's talk grade 1 and grade 2. So let's say you're working out, you went and did Spartan race, and you feel that pull underneath your butt cheek, and you say, man, it really hurts and it feels really tight. What do I do about it? What is the doctor gonna do about it? Well, first off, he or she is gonna test the strength of the muscle and figure out, is it in fact impeded? You know, they're gonna palpate and figure out, is there any palpable deviation happening in the back of the hamstring? If so, that's gonna completely change the way that we go about caring for it. Now, with all of that being said, we really follow what we call PRICE. And that's a protocol. It's a PRICE protocol. And there's P stands for protect, rest for R, ice, compression, and elevation. Now, how do we do about that? So obviously ice is a big thing that people are always gonna say you should definitely ice. I agree, you should ice it. Ice baths are actually better than just taking an ice pack and putting it on the hamstring. And why do I say that is because when you sit in an ice bath, that's a bathtub filled with ice cold water down to like 40 degrees, you can immerse all the way around the muscle. You can get in like those little weird crevices and stuff that typically just using an ice pack is not going to do. And you're gonna stay for it about 10 or 15 minutes at about around that. Now, the second thing that you wanna do is you wanna compress it. So I tell all of my athletes to go, if they don't have, and buy or purchase compression pants. So Under Armour pants, Lululemon pants, the pants that cause compression that could surround that muscle and bring it and make it a little bit tighter. And the reason that we use compression pants is for 2 things. First off, it increases the blood flow to the area. And the second thing is that the muscles are tighter together, so they're able to recruit and help one another as you're going about and moving throughout the rest of your day as that muscle is trying to heal. All right, so we have protect, rest, ice, compression, and then elevation. And what elevation means is simply you want your leg to be higher than your heart. And the reason is because if you've torn it, your body is sending nutrients to the area to help it heal, and you want to help to decrease the swelling, decrease the amount of extra nutrients that are in the area. And by elevating the leg, it helps to impede the flow back to the heart, which gets rid of all of those extra nutrients. Now, in addition to that, we as sports chiropractors, physical therapists, what have you, I'm a firm believer in kinesio tape. Rock tape is my favorite tape to use, and in stage 1, meaning you just pulled it, you want to use like a spider-like fan when you're laying the tape over the top of injury. So I'm sure you've seen those long pieces of kinesio tape. We cut them up into like 4 little fingers, and I have you lay them like this. And the reason that I have it laid like this is because in between those little pockets that you see there, that helps to lift the skin and helps to get rid of the nutrients as well. So I'm a firm believer in kinesio tape, especially after a hamstring injury. You put the base of it lower on the leg and you work it up with the fingers going up towards the butt, towards the glute area. Now, question that people are going to ask is, Beau, should I foam roll it and should I stretch it? And my answer to you immediately is no. I do not want you to going back to light jogging. I don't want you to go back to stretching. I don't want you to go and try to like, it's tight, I want to mash it out, Beau, and get it loose. No, that's not what you want to do with a pulled or a strained hamstring. Your body needs about 48 hours to 72 hours to allow those nutrients to come back into the area and to kind of solidify over the area that was just injured. And if you're having deep tissue massage over it, or you're taking your hypervolt or you're doing foam rolling over the top of it, it's actually going to, and every time that you do that, it's resetting the clock, so to speak, of that injury cycle again, and that can ultimately cause more harm than good. So what we say is do not cause any harm, and harm meaning no heat, so do not apply a heating pad, no alcohol, so don't drink please, don't do any sort of running, and don't do any sort of massage over the muscles, at least for about 72 hours. Now, after that, depending on what level that you are, that's when I start to introduce very light stretching. So if you're a grade 1 or you're on the bottom side of a grade 2, after 72 hours, you can do some light stretching. Now, what does that mean? That means like you can sit on like a bench and put your leg up as you would go down to stretch, but you're only going down to the point of tension. You're not going to go and try to like overstretch it and increase your range of motion right now. Now is not the time to do that. After about 2 to 4 days of that, then if you have the integrity and the strength coming back to the hamstring, we can start doing some more incline walking and some higher paced walking, ultimately leading to a little jogging after about 1 week. Now guys, if you're an athlete and you're watching this right now, like if you're in season and you pull your hamstring, understand guys, hamstring strains and hamstring pulls are one of the biggest chronic injuries that we see day in and day out on the field of competition. It's something that happens and people constantly re-injure their hamstring, re-injure their hamstring, re-injure their hamstring. And why does that happen? It's because they do not do all the rehabilitative stuff on the front end, and they try to return to play too early. So if you have a hamstring strain right now and you're an athlete, you've got to work with your doctor, you got to work with your physical therapist, you got to work with your personal trainer, and you've got to go through all of the individual phases before you should be back on the field of play. And the reason is because you're going to go out there and you're going to want to go run, and you're going to want to jump, and you're going to make sharp stabbing movements and slowing down and speeding up, and your hamstring, if it's not fully healed, it's not fully connected, it's not fully strengthened again, it's going to be apt to re-tear again. Now guys, I'm going to tell you this. I hate to say this because I am not the doctor that likes to pull people off the field by any means, but do not mess around with a hamstring strain. I cannot tell you how important that is. These are one of these things that you can pull them once, you rehab it, and then, you know, 3 months later you can do it again and again. So really, guys, take the extra time to really focus in, do the right rehab, do the right exercises, do the right stretches to get your body fully healed before returning back to full activity. All right, guys, I hope that helps to answer some questions about a hamstring strain. What do I do about it here in practice? Obviously, my job is to assess where you're at, assess if you're a grade 1, grade 2, grade 3, give you some recommendations of care of things that you can do by yourself, as well as things that we're going to do here in my office or whatever office that you decide to go to, and ultimately create a plan that works for you as the athlete, me as the doctor, to give you the best opportunity to return back to your field of play at pre-injury status, if not better. All right, if you guys have questions, please ask me below this video. As always, I always jump on here and answer your guys' questions, everything that I can do to help you guys out. Hope you guys have a good one. I'll talk to you later. Bye now.